Today we will discuss living with diabetes and how to self-administer insulin. Using insulin yourself can be a more effective way to manage your diabetes. Steps to success, most importantly, are that to make sure you have the right dose of insulin, especially if you're giving yourself 2 types of insulin in the same syringe. Practice how you're going to give your injection. Also, ensure that you're storing the insulin properly so that each dose will work effectively. The first thing you're going to need to do is make sure that your supplies are all gathered. Select a clean, dry area to work in. Grab your bottle of insulin. Sterile insulin syringe, 2 alcohol wipes, and a container for the used equipment. Most importantly, make sure you wash your hands. The next step is preparing the insulin. Remove the plastic cap from the insulin bottle. Roll the insulin bottle between your hands 2 to 3 times to mix the insulin. Do not shake the bottle. The air bubbles that can form can make the amount of insulin drawn up ineffective. Wipe off the rubber part of the top of the insulin bottle with the alcohol pad or a cotton ball dampened with alcohol. Set the insulin bottle nearby on a flat surface. Remove the cap from the needle. Draw up the required number of units of air into the syringe by pulling the plunger back. You will need to draw the same amount of air into the syringe as the insulin you need to inject. Always measure from the top of the plunger. Insert the needle into the rubber stopper of the insulin bottle. Push the plunger down to inject air into the bottle. This allows the insulin to be drawn more easily. Leave the needle in the bottle. Turn the bottle and syringe upside down. Be sure the insulin covers the needle. Pull back the plunger to the required number of units. Measure from the top of the plunger. Check the syringe for air bubbles. Air bubbles in the syringe will not harm you if they're injected, but they can reduce the amount of insulin in the syringe. To remove air bubbles, tap the syringe so the air bubbles rise to the top and push up the plunger to remove the air bubbles. Recheck the dose and add more insulin to the syringe if necessary. Remove the needle from the insulin bottle. Carefully replace the cap on the needle. Select your injection site. You're going to want to rotate the insulin injection sites as to not cause your body too much harm. We suggest using a clockwise pattern around your navel to ensure that you're selecting a different site for each injection. You want to keep the sites 1.5 inches to 1 inch apart. Now you're ready to prepare the injection site. Clean the area you have selected with the alcohol wipes. Use a circular motion to clean about 2 inches of your skin around the injection site. Keep the alcohol wipes nearby. Now you're ready to inject the insulin. Using the hand you write with, hold the barrel of the syringe with the needle end down like a pen, being careful not to put your finger on the plunger. Remove the needle cap. With your other hand, gently pinch 2 to 3 inch fold of skin on either side of the cleaned injection site. Insert the needle with a quick motion into the pinched skin at a 90-degree angle, straight up and down. The needle should be all the way into your skin. Push the plunger and the syringe until all the insulin is out of the syringe. Quickly pull the needle out. Do not rub the injection site. You may or may not bleed after the injection. If you're bleeding, apply light pressure with the alcohol wipe. Cover the injection site with a bandage if necessary. Once you're complete, be sure to dispose of your syringe properly. Do not just throw it away into the trash. Use the specified sharps container. Using these steps, you too can live happily with diabetes.